In October of 2002, I was teaching emergency medicine in Bali at the time of the nightclub terrorist bombing. We treated hundreds of people with blast injuries. That event, as unfortunate as it was, illustrated to me personally how important it is to be prepared to treat these unique injuries. The majority of injuries from a nuclear weapon or dirty bomb result from the blast, not the radiation. In addition, conventional explosives remain the weapon of choice for terrorists worldwide. For this reason, caregivers need to be prepared to deal effectively with blast injuries. There are two main categories of explosives. High-order explosives include dynamite, TNT, ammonium nitrate, and, of course, nuclear weapons. All explosives in this category create a supersonic overpressurization wave, or a blast wave, that has the potential to cause severe injury and fatality. Low-order explosives create a subsonic explosion. This group includes gunpowder, pipe bombs, and petroleum-based explosives like Molotov cocktails. There are four basic mechanisms by which blasts cause injury. Primary blast injury is exclusive to high-order explosives and results from the overpressurization wave. The most vulnerable human organs are those that are gas-filled, such as the lung, the ear, and the bowel. Primary blast injury occurs only in high-order explosives, never in low-order explosives. Secondary blast injury results from flying debris and fragments that can cause penetrating injury to any part of the body. Tertiary blast injury results when the victim is accelerated by the force of the blast or the blast wind. Typical injuries from this mechanism are head and neck injuries as well as fractures. The final category includes all other explosion-related illnesses and injuries. This is a broad category. It includes such things as inhalation of toxic and heated gases, indirect injuries such as crush injuries or burns, medical illnesses such as angina or asthma that are exacerbated by the explosion, and finally radiation in the case of a nuclear weapon or a dirty bomb. Among survivors of the explosion, blast lung is the most common cause of late death. Blast lung can be diagnosed by a characteristic butterfly pattern on the chest X-ray. These patients are very susceptible to arterial air embolism and pneumothorax, a risk which is increased when they're mechanically ventilated. Caregivers should examine all blast survivors for injuries that may not be apparent. These include injuries to the eye, ear, brain, and abdomen. In particular, peritonitis from intestinal perforation is a delayed complication. Therefore, these patients should be observed for an appropriate period before we discharge them. It's often difficult to predict both the timing and the numbers of patients that will arrive after an explosion, but a hospital should expect that the least severely injured will bypass the pre-hospital care system and arrive at the hospital before the more severely injured. Additionally, victims of explosions will often experience short-term and long-term psychological effects, which may require mental health care.
Conventional explosives remain the most common terrorist weapon worldwide. To provide effective treatment, caregivers need to be familiar with the characteristic patterns of blast injuries. Among survivors of an explosion, blast lung is the most common cause of subsequent fatalities. Caregivers should examine all blast survivors for internal injuries that might not be immediately evident.